Gentleman yields back. For what purpose does the gentleman from New Jersey rise?
I move to strike the requisite number.
Gentleman is recognized for 5 minutes.
Madam Chair, I rise in support of the amendment that Ms. Lowy presented and in opposition to this continuing resolution, which would completely eliminate the National Women's Health and Family Planning programs known as Title X. The resolution we're considering would cut care to Americans who need it most. Title X funds ensure that millions of low-income and uninsured individuals have access to primary health care. For most of these individuals, this is the only medical care they receive. Without access to this health care, they're at risk of developing serious medical conditions. If Title X funding is eliminated, it would remove the only access point to primary health care for millions of women and would increase the health care costs for all Americans. Now, some of my colleagues would argue that Title X is all about abortion. That statement is simply not true. These programs fund prevention, provides life-saving care to millions of women each year, cancer detection, care provided, women and families treated with the dignity they deserve, and it is family planning. I know these claims, and I know the work of these clinics and their importance to our society. Now, maybe the men who put together this continuing resolution don't know what these programs do. I assure you, I do. Cutting funding to these programs would be devastating for women's health, and I strongly oppose efforts to do so. These programs prevent an estimated 1 million unintended pregnancies each year. For every dollar spent on family planning, several dollars are saved in Medicaid costs. These clinics provide life-saving and preventive care to millions of women. In 2009 alone, providers performed millions of Pap tests, millions of breast exams, over 6 million tests for sexually transmitted infections, nearly 1 million HIV tests. In my home state of New Jersey, it's estimated that the elimination of these programs would cause as many as 40,000 patients to lose their access to women's health care. I estimate that without these funds, 14 community health centers would close their doors. We need to take a careful look at who we hurt by cutting these programs. In 2009, these funded health centers provided services to over 135,000 patients. Eliminating national family planning programs would result in millions of women across the country losing access to primary care and preventive health care. I can't emphasize that too strongly. Simply put, without these programs, more women will experience unintended pregnancies, face potentially life-threatening cancer and other diseases that could have been prevented. This is unacceptable. I yield back my time.
Gentleman yields back. What purpose is the gentlelady from Ohio rise?
Mr. Speaker.